Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight's topic, I'm going to talk about dissociative disorders in a more in depth presentation than I did yesterday. Yesterday's video was a brief introduction because in that video, I gave you the definition, the types of dissociative disorders, and I briefly covered some of the treatments. Now, this video is going to have a little bit more information because the symptoms and the type of dissociative disorders will be discussed, and I'm going to give you information on how to best manage your situation if you have a dissociative disorder. Now, when one talks about a dissociative disorder, you have to realize that it's a disorder that is characterized by an involuntary escape from reality, which involves a disconnection between thoughts, identity, consciousness, and memory. Now, people from all ages, groups, racial, ethnic, and socioeconomic backgrounds can experience a dissociative disorder. Now, it is estimated that 2% of people experience dissociative disorders, with women being more likely to be diagnosed than men. Almost half of the adults in the United States experience at least one depersonalization, derealization episode in their lives, with only 2% meeting the full criteria of the chronic episodes. Also, the symptoms of a dissociative disorder usually first develop as a response to a traumatic event such as abuse or military combat. To keep those memories under control, stressful situations can worsen symptoms and cause problems with functioning in everyday lives. However, the symptoms a person experiences will depend on the type of dissociative disorder that a person has. Now, the treatment for dissociative disorders often involves psychotherapy and medication. Now, though finding an effective treatment plan can be difficult, many people are able to live healthy and productive lives. Now, when it comes to symptoms, the symptoms include significant memory loss of specific times, people, places, and events, out-of-body experiences such as feeling as though you're watching a movie of yourself, mental health problems such as depression, anxiety, and thoughts of suicide. Also, there's a sense of detachment from your emotions or emotional numbness. Lastly, there's a lack of a sense of self-identity. Now, the symptoms of dissociative disorders depend on the type of disorder that has been diagnosed. Now, there are three types of dissociative disorders defined in the DSM. Now, the DSM is a diagnostic and statistical manual of mental disorders. First, there's the dissociative amnesia. This is the main symptom of difficulty remembering important information about oneself. Now, dissociative amnesia may surround a particular event, such as combat or abuse, or more rarely, information and identity when it comes to life's history. The information about what you are going through is rare because, for the most part, individuals will keep their life history, medical history, very secret unless you talk with a counselor. Now, the onset for an amnesic episode is usually sudden, and an episode can last minutes, hours, days, but rarely months or years. Now, there is no average for age onset or percentage, and a person may experience multiple episodes throughout their lives. Now, there's a depersonalization disorder. Now, this order involves ongoing feelings of detachment from actions, feelings, thoughts, and sensations as if they are watching a movie. That's known as depersonalization. Now, sometimes other people and things may feel like people and things in the world around them are unreal. That is known as derealization. Now, a person may experience depersonalization, derealization, or both. Now, symptoms can last just a matter of moments or return at times over the years. The average onset age is 16, although depersonalization episodes can start anywhere from early to mid childhood. Less than 20% of people with this disorder start experiencing episodes after the age of 20. Then there's the DID. That's the acronym for Dissociative Identity Disorder, formerly known as Multiple Personality Disorder. This disorder is characterized by alternating between multiple identities. That's right. This disorder is characterized by alternating between multiple activities. Now, a person may feel like they're hearing one or more voices that are trying to take control in their head. A person also utilizes these identities by creating unique names, characteristics, mannerisms, and voices. People with dissociative identity disorder will experience gaps in memory and everyday events, personal information, and trauma. Women are more likely to be diagnosed as they frequently present with acute dissociative symptoms. Men are more likely to deny symptoms and trauma histories and commonly exhibit more violent behavior rather than amnesia or fugue states. This can lead to elevated false negative diagnosis. Now, with every mental disorder, there are causes. Dissociative disorders are no different. They usually develop as a way of dealing with trauma. Dissociative disorders often form in children who have been exposed to long-term physical, sexual, or emotional abuse. Natural disasters and combat can also cause dissociative disorders. Now, when it comes to diagnosis, doctors diagnose dissociative disorders based on a review of the symptoms and personal history. Now, a doctor can perform tests to rule out physical conditions that can cause symptoms such as memory loss and a sense of unreality. For example, head injury, brain lesions or tumors, sleep deprivation, or intoxication. If physical causes are ruled out, a mental health specialist is often consulted to make the evaluation. Now, many features of dissociative disorders can be influenced by a person's cultural background. Now, let me repeat that again. Many features of dissociative disorders can be influenced by a person's cultural background. Now, in the case of dissociative identity disorder and dissociative amnesia, patients may present with an unexplained, non-epileptic seizures, paralysis, or sensory loss. In settings where possession is part of cultural beliefs, the fragmented identities of a person who has a dissociative identity disorder may take the form of spirits, deities, demons, or animals. Now, intercultural contact may also influence the characteristics of other identities. For example, a person who is living in India exposed to Western culture may present with an alter who only speaks English. In cultures with highly restrictive social conditions, amnesia is frequently triggered by severe psychological stress, such as conflict caused by oppression. Finally, voluntarily induced states of depersonalization can be part of a meditative practice prevalent in many religions and cultures and should not be diagnosed as a disorder. Now, when it comes to treatment, dissociative disorders are managed through various therapies, including cognitive behavioral therapy, known as CBT, and dialectical behavioral therapy, known as DBT. Then there's also eye movement desensitization and reprocessing, known as EMDR. Medications such as antidepressants can treat symptoms of related conditions. Now, related conditions appear on the trauma spectrum. Many patients may have conditions associated with trauma as well as additional trauma-based conditions. And the trauma-based conditions are familiar mental health issues that I've talked about. And there are 5 of them. PTSD, post-traumatic stress disorder. That's post-traumatic stress disorder. Borderline personality disorder, substance abuse, depression, and anxiety. And that's this edition of the 401 Talk Zone radio show for this evening, Friday, June 16th, 2017. You can tune into the 401 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest call-in number is 215-383-5785. And if you like my videos, please share and subscribe to the 401 Talk Zone radio show right here on YouTube so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now, on this channel, I don't engage in topics that involve debates, emotional, or controversial issues, nor do I participate in drama or unnecessary bickering. My channel is for educational purposes. Now, what I do here at the 401 Talk Zone radio show is research the information, and I utilize my own personal experiences as tools so I can present the topics from an objective point of view. But when I present the topics, I make sure that they are real and they are positive, because the real world is a complicated place to survive if you don't have the knowledge and the understanding of how the systems work. That's why I always say knowledge is power. No one can take your knowledge away from you. And if you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, I like comments and I do read comments. Place your comments under the video in the comment section, but make sure that your comments are pithy, no bloviating, pettifogging, or filibustering. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed evening. Good night.